If you have a problem with a break or with some kind of immediate injury, I would first evaluate you. I would look at your x-rays and I would look at your problem clinically, and then we would talk about the injury and we would discuss different treatment options. First, I usually tell the patients about the condition as much as I can, just so that they can have an idea of what the problem is, and then we would have a shared decision making about their treatment options. And I usually tell patients about the risks and benefits of operative treatments, non-operative treatments, and all the other modalities that go into the non-operative treatments. If we decide on the operative treatment, then we go into the post-operative care. Well, first we talk about the surgery itself and risks and benefits, and then into the post-operative care that follows. And usually some people need therapy for some serious injuries and all that's involved with that. If it's an arthritis problem, if it's not an immediate injury, but just chronic problem that keeps bothering patients, we try all the non-operative treatments first. We talk to them about bracing and injections and therapy and medications, and we usually try all of these things. And then if patients can't stand the pain anymore and if it really bothers them, then we start talking about surgical options, and again we talk about the surgery and all the treatment that follows. One thing specific to hand surgery, there is development of a specific enzyme injection for Dupuytren's disease, which is a contracture of the fingers that develops over time, and it avoids an operation. Instead of performing surgery, you can do an injection that will improve the alignment of the finger instead of doing surgery. Also, another recent thing is percutaneous trigger finger releases. So a trigger finger is a condition where patient's finger gets locked or clicks as patient bends it, goes from flexion to extension and vice versa. And the newer way of treating this, if the problem is amenable, is with a percutaneous release, where we can avoid an operation and we can perform a procedure where we use a needle and only about 2 or 3 poke holes to release the tight canal in the patient's finger. Obviously, all of this is done after non-operative treatments are tried, such as steroid shots and things like that. Well, I specifically see a lot of hand problems, such as trigger fingers. Also, people have a lot of numbness and tingling in their fingers, usually representing some kind of nerve compression, either carpal tunnel or ulnar nerve compression at the elbow. There's also a lot of injuries to wrists, and patients can have wrist fractures and finger fractures that we occasionally repair. There's also a lot of inflammation of different tendons, and sometimes we're forced to do tendonitis surgery, operations to relieve compression of these tendons. And sometimes there's just bad traumatic injuries where patients cut their fingers or their arms with glass that breaks, with knives and all other sharp objects that we have to repair. Also, when I do general orthopedics, I work on broken shoulders and other body parts. Sometimes when lifting something heavy, a person can experience a pop in their arm that would result in pain and weakness of elbow flexion, bending the elbow. And so oftentimes people can have an avulsed, torn tendon, biceps tendon, that bends their elbow. And in that case, we often offer a repair, surgical repair of that tendon. Also, a lot of people playing basketball and things like that, and fingers always get jammed into balls and football, and all kinds of problems with the fingers from sports as well.